right? Pretty hard. Okay, try. Ready? Go. Yeah. So we call that like kind of like a break test. Like he's got a little bit of strength, but if I hold it for any longer than a couple seconds, it just breaks. So moment of truth. We're going to test this leg again. So in theory, you can get on the outside of your foot again. So this should be better. So don't let me move you. You ready? Go. Yeah, way better, eh? And then we just did a functional assessment with Riley, and what we're noticing is that he's not getting onto the outside of his foot. And he said that he's having a little bit of issues with some edge work going that way as well, or getting into his left hip. So now what we're doing is we're just testing to make sure that the functional test carries over. So for example, I'm just going to test his hips here and his hip abduction essentially, or abductors. So I'm just going to bring this leg out to the side, Riley. Don't let me move you. Okay, ready? Go. So like he's pretty strong on that side. Now we expect, because he can't get on the outside of his foot, he can't coordinate the outside of his leg very well. So I'm just going to bring that foot out to the side. Don't let me move you. I'm going to push you towards the door there. Ready? Go. Right? Pretty hard. Okay, try. Ready? Go. Yeah. So we call that like kind of like a break test. Like he's got a little bit of strength, but if I hold it for any longer than a couple seconds, it just breaks, right? And then because of that, because he can't get on the outside of his foot and can't use the outside of his leg, he's also jammed up in internal rotation, and you're getting a little pinching there, right? Whereas if I go this side, he's got no pinching. It feels pretty good. It's more of like a stretch in the tissue, okay? So what I'm gonna do is, in theory, if we can get this basically subtalar joint moving a little bit better, your brain will be like, hey, I can get on back on the outside of my foot, and then it'll kind of light up the outside of that leg, and you'll be like, hey, I can remember how to do this. So you're gonna lay on your side, face the skeleton there, bring this knee up out of the way, and just heel over the edge. So I'm just gonna do a couple of subtalar mobs here. So if you're uncomfortable with anything, just let me know. Okay. But that's all right?
Yeah, that's good.
Okay. So yeah, I'm just taking them into like end range dorsiflexion, stabilizing above the calcaneus there. And I'm just pushing, oscillating up and down to the beat of staying alive. Good, switch over to the other side. Same foot. So bring the bottom knee up out of the way. Good. And then I'm just gonna bring that there. So I could just work on one side, but usually when I'm here, I find it helps to mobilize both sides. Good. A little tighter on this side, eh? You can feel that one. Starting to move though. Okay, good. And then lay on your back with just your ankles over the edge. All right, so now I'm gonna get talus moving. So it's this little bone here. It's kind of like a wedge in the door. It can kind of get lodged to the front, especially if you're in skates a lot. So I'm just gonna be pushing down on this bone. It's gonna be a little tender. Just relax the foot. You might get some popping and creaking. A little tender. Good. Good. Just come over to this side here. It's starting to move there now. You can feel that. All right, so now we're going to do what's called a J mob. So basically I'm just pulling your fibula out of the way here. I'm placing kind of like the side of my hand on your talus there. I'm just going to give you a little pull. Take a deep breath in for me. And out. Good. Yeah, so it's already moving pretty good from that last one, but you can kind of feel it moving in there.
Yeah.
And then, so yeah, I'm just basically making like a J movement. Good. All right, so moment of truth. We're gonna test this leg again. So In theory, you can get on the outside of your foot again. So this should be better. So don't let me move you. You ready? Go. Yeah, way better, eh? And then hip should be better as well. Not perfect, because I still need to work on it, but a lot further, eh? Yeah. Like probably another 20 degrees and less pinchy. Yeah. Yeah, less pinchy. Yeah, so just loosening up that foot is gonna help you a little bit with your edge work. Okay, good, right there is good. All right, bring that bottom knee up, so towards your chest. Yep, good. Then I'm gonna just lift your foot up, and this is gonna just go underneath. Perfect, right there. All right, come back just a tiny bit. I'm gonna stabilize you. All right, so in this position, it's a little bit easier to mobilize that posterior hip capsule, just because basically the sacrum and the pelvis aren't like restricted up against the bed. So I'm just gonna grab here. If you get any pinching in that hip, let me know, and I just need to readjust. Right. But you should just feel like a deep stretch on the kind of like outside of that hip. So I'm here, I'm pulling up. Feel stretch? Yeah. Yeah, quite a stretch in the back of that hip? Yeah. Yeah, okay. But no pinching? No. No, just an intense stretch. Good. So yeah, like there's multiple ways to do this, but I tend to like this variation just because the pelvis and sacrum have a little bit more freedom of movement. Good. So I'm just holding and just breathe. Try to relax it. I know it's hard. Okay, I'm just gonna come up a little higher. Again, if you get any pinching, let me know. Just more stretch? Yeah. Okay, good. And because I like mobilized your foot already, this should be a little bit more free. Yeah. Like I would expect if I started with this, you probably would have had some pinching, so. Good. All right, then land your back again. And then again, if I retest that internal rotation, it should be a lot better. Right? Yeah. Oh yeah, way further, right? Okay, good. All right. And then I'm just gonna do one more mobilization here. So I'm just gonna push that down. So I'm just basically pushing your hip to the back of the socket, or the femur, head of the femur. And then you should just feel a stretch on the outside of the hip. Yeah. Okay. Yeah, good. Or maybe a little bit in the hamstring, but. So yeah, all I'm doing is pushing the head of our femur, kind of the back of the socket, so that we're taking pressure off the front. All right. Any pinching there? No. Okay. Just an intense, deep stretch in the back of the hip. Good. Good. All right. And then should feel even better. Yeah. That's good. Okay, so now I'll get you to stand up. Just stand over there for me. So we tested that foot, and you couldn't get on the outside of that foot when we started. So if you balance on that left side now, it might be a little wobbly because I just loosened the crap out of it. Yeah. But now you can see you could fall either way. Yeah. Right? Now you're back on the outside of that foot. Yeah. And then the other one you had issues with because of the foot and the hip. So if you put your feet on the ground and rotate to your left for me. So just like whole upper body. Yeah. Yeah. Way further and way easier, eh? Yeah. Like before you felt like stuck when you were going that way. So if you go there now, see, and you can see he's not lifting up that foot anymore to get there, and it's a lot further and smoother. Cool. All right, so with gait, what happens, so like we're looking at his foot now in a sense from the gait point of view. So when you step down, your heel goes this way, your pelvis moves away, right? So when your pelvis is moving away, your foot pronates or collapses in. And then when I go to generate power and get into this hip, my pelvis starts to rotate back towards this side, and my arch comes back on or supinates, and I push off, right? So a way that we can train that, a little bit of exaggerated, but what he's gonna do is he's gonna come against the wall. So he's gonna have that, because the left side's the problem side, you're gonna lean into the wall, okay? This hip stays on the wall the whole time. Then you're gonna bring this leg back in RDL. I just use a ball to hug onto. And then from here, what I'm doing is I'm opening this hip. So remember when I said the pelvis, when the pelvis turns away, the opposite foot pronates. So it's gonna flatten out, okay? Without that knee coming in too much. And then as I close down and try to get the front of this hip or the anterior iliac crest here towards this knee, that hip's still on the wall, you'll see my arch come on, right? So I'm here, arch collapses, and then as I come down, I'm turning my pelvis towards that side, so my arch is gonna come on, just like in normal gait. So like try that. So lean into the wall, come back into that RDL, good. Right, so now you're gonna open up as far as you can, you're gonna feel kind of this come down, right? And then close, try to get the front of this hip or this bone right here towards this knee without this hip coming off the wall. You're gonna feel a stretch there, and you're gonna feel this arch come on, right? And then keep going, so open up. This comes in, right? Stretches out your adductors a little bit. And then as you close, see that arch picks up, right? And he's not like super high arched anyway, so it's pretty small, but you see how everything just kind of splays and then picks up. And then your left hip is just on fire. It's like burning like crazy. That little lean makes all the difference, makes it a little bit more, takes the balance out of the equation and allows you to focus a little bit more on that hip. Yeah, like it feels like it's gonna cramp. Yeah.